Hi everyone, my name is Kaitlyn Smeltzer and I'm proud to be up here representing the bachelor's program. So I'm here today to tell you about my final paper, which is about health promotion and workplace wellness in the oil sands, and a program proposal that I came up with. So I'll see if Prezi's going to cooperate with me here. Okay, so first of all, I'd like to tell you about where I did my practicum. I did that with the Canadian Cancer Society, which is a national nonprofit organization whose mission is to continuously work to bring an end to cancer. During my practicum, I did quite a bit of work with their Wellness Fits program, which is a free comprehensive workplace wellness program that they offer to select businesses in BC. And so for my practicum case, I've created a proposal for an adapted Wellness Fits program that would be suitable for an oil sand setting. And I developed this based on the specific needs and challenges of this workforce. So just the issue that I identified was that the Wellness Fits program has been typically accessed by secondary and tertiary industry businesses, and that I feel that there's a real need for workplace wellness programs within the primary industry, specifically in the Athabasca oil sands of Alberta. Okay, so just a bit about the Athabasca oil sands. They're large deposits of heavy crude oil located in northeastern Alberta. Provides thousands of jobs to mobile workers from across Canada and around the globe. These job settings very physically and mentally draining and can take a serious toll on personal health. I know personally I just had tendonitis surgery for a work-related injury as I work in the oil sands myself. I'm going to cover the challenges and barriers that this workforce faces. That would be living and working in a camp setting, a lack of family support for employees being in camp, a largely male-dominated workforce, a high percentage of older employees, contrary to popular belief, a unique workplace culture, which has a potential to influence how employees view their health and the various activities related to health in the workplace. Okay, so I'm just going to discuss the program adaptations I made to the original Wellness Fits program. The first being incorporating health and wellness content of the online modules into the daily lives of all employees. So this is going to ensure that regardless if employees want to enroll in the online portion of the program, that they're going to have the opportunity to learn about the health topics and new ways to adopt healthier behaviors in the workplace and at home. Health promotion was also going to be implemented into the daily lives of all employees in and around the camp setting. That would include quick health tips at work meetings. Second adaptation I made was adapting the actual content presented in the online modules. Topics and health information focused in the modules would be designed to relate to the employee population. This will include anti-smoking messages targeted to males, or information how to deal with the different stresses of being in camp, like isolation and being away from their families. So the third adaptation is how my program will be facilitated, and this is going to be by an interprofessional team. This incorporates different interprofessionals and employees in the camp setting. And facilitation will be undertaken by 4 parties. So the first being camp medical staff, who will run the online portion of the program. The health and safety staff, who present health information to staff during the health and safety meetings at work. Employee wellness champions, who present quick health tips at work meetings and encourage and support healthy behaviors on the job site, and a Wellness Fits coordinator who's going to provide the overall training for everyone. Lastly, I would just like to discuss how my proposed program incorporated public health and social policy core values. I feel that it included partnerships with people and populations served, as it recognizes that oil sands employees have specific needs for a health promotion program, and it works to enhance employees' capacity to take control of their own health and wellness, and also includes interprofessional and multidisciplinary practices. As I discussed earlier, it includes interprofessional collaboration. I'd like to thank everyone for my quick references there. Just a few. I'd like to thank you all for listening to my presentation, and I'd like to say thank you to my practicum supervisor, Nancy Faulkner, and everyone at the Canadian Cancer Society. It was a really great experience.
Nice job, Kaitlyn.
Thank you.
Zip right through,
Whew.
Just under 5 minutes.
I didn't pass out, so
okay,
yeah.
That was a lot of information in a tight little package. Any questions for Kaitlyn, either about her presentation or her practicum at the Cancer Society? Questions? Oh, okay, Lynn.
So since I always follow instructions, I'm Lynn Davis. I'm one of the faculty members. So, Kaitlyn, has there been any take-up of this program in the oil sands, or have you made recommendations as to which sites might do it?
I hope to. I'm actually going to be presenting everything that I've worked on there's a sector of the Canadian Cancer Society who is actually working on a similar project. It's actually in northern BC, and I'm going to provide them with everything that I've worked on and any help I can give them. And once I get back to work, I would like to possibly try to slowly start working things in. It's my goal, at least.
Any other questions? Oh, where? Who? Somebody raise your hand up high. Hi.
My name is Helen Christensen. I was fascinated by your practicum project. My son is working in the oil sands, so I get daily reports, weekly reports of the horrendous conditions that he's experiencing. And he works not for a big camp, but more of a smaller company. And I'm just wondering if any of these strategies can be, taken up by the more independent oil sand companies, and whether there's any plans to extend them to those sectors.
I definitely think that they could be. I mean, it's really, I work in a very large camp, and so I kind of went at it from the bigger sector, but I do know that there's all these smaller companies that are all come into these camps, and so I do think that it would be possible for smaller companies to adopt this program, and possibly even if maybe the larger camp itself didn't want to adopt the Wellness Fits program, that they could undertake it and make sure that it's being presented to their employees, which I think would be really great. It's definitely a new, I know it hasn't been undertaken yet, but I think it's really necessary, and I hope that it's adopted. Got to get out there.
Thank you.
You're welcome.
Thank you. Any final questions? Oh, one over here.
Thank you for that presentation. That was really great. Just a quick question. Do you know how much this will cost if it was uptaken by companies?
Sorry?
Do you know how much it will cost?
The Wellness Fits program is actually free, so it would not cost them anything. The Canadian Cancer Society would, like I say, through the Wellness Fits coordinator, provides all the training and the online modules and support. And I mean, this is a bit more of a complicated program, so it would include more training and stuff, but the goal is for it to be actually free.
Thank you. All right. I think we will let Kaitlyn go. Thank you, Kaitlyn.
Thank you.